Hi everyone! Today I will be teaching you how to help your child to produce the F or the V sounds. So, maybe your child is unable to say feather or muffin or giraffe. Maybe they say peather, or maybe they say muffin, or maybe they say giraffe. What both of these sounds have in common is the fact that you can see them. And so the very first thing that I do is I always use a hand mirror to help them to have good visual feedback to see where these sounds are produced. So as the student is sitting next to me, I hold the hand mirror and I show them to do the F sound or to do the V sound, your teeth have to be on your lip, on your bottom lip. Your top teeth have to be on your bottom lip. So it's also almost like biting on your lip, but you don't want to bite too tightly. So watch me. So once you put your teeth on your lip, then you're going to blow air. Watch this. Or, depending on which sound you're working on. And then sometimes I let the child know this is like the angry cat sound. Or the angry cat sound. So, or like you're driving a car and it's going fast. So once the child is able to produce the sound and they're able to see it in the mirror, then we'll move on to the next step. But I first want to make sure that they're able to produce that F sound or that V sound by themselves. The difference between the F and the V sound is voice. So if you put your hand on your throat and you go, you shouldn't feel anything vibrating. But if you put your hand on your throat and you go, you'll feel it vibrating because your vocal folds are moving and your V sound has voice and your F sound doesn't have voice. So let's focus in on the V sound. If your child is having difficulty producing the V sound, you would use these same strategies to help your child if they're misproducing the F sound because they're produced in the same way. One just has voice and the other doesn't. So say your child is not able to say vacuum, and instead of saying vacuum, they're saying vacuum. So you first want to see if they can produce that sound in isolation using the mirror. So, can you try that? Make sure your top teeth are on your bottom lip when you're doing it. You try that. Try that 3 times. Yay! That was really good. Once your child is able to produce that V sound in isolation, then you want to move on to can they do this in syllables. So if your child is having difficulty producing the V sound in the initial position, that means with words like vase or vacuum, where the V is at the beginning, then you start with the syllables they, e, I, o, u. So they, vi, vi, vo, vu. So I would first go, let's try that first one. A. 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 This is in the mirror, so they're seeing it and I'm seeing it as well. Now you try that. A, and allowing the child to do it. A, 3 times. Now let's blend it together. A. They. You try that. A, bay. Oh, that was really good. I heard your new sound at the beginning, but then when you blended it together, it turned into your old sound, bay. Let's try that again. Make sure that your top teeth are on your bottom lip. A, they. You try it. A, they. Yay! Very good. So you want to use something that could be a visual for them to connect that. We want to now blend those words together. So once they got they have they, then you're going to go on to V, E, E, E. Again, using the mirror so that they can see the differences that are happening as you're going through the syllables. A, E, I, O, U. Your mouth is heavily moving as you're moving through those syllables on your list. And you want to make sure that they're being able to see that based on the syllable and the sound of the vowel, their mouth is going to do different things. So once your child is able to produce that V sound or that F sound, fe, fi, fi, fo, fu in syllables, then you move on to word lists. And so you'll find word lists of initial F sounds or initial V sounds, fast, friend. Well, don't do FR, don't do blends. Just fast, favorite, fan, and you're going to work through that list of helping them to produce that F sound with the rest of the word. Same thing with the V. Vase, van, vacuum. You're going to help them to produce those V sounds using the hand mirror and being patient. Work on their speech skills at least 5 minutes a day with them to supplement what they're doing in speech therapy so that they can get the practice that they need to make maximum progress. If your child is not producing the V sound in the middle position, then you're going to use the medial syllables. And so that's with the V in the middle. So this is ave, ev, iv, ovo, and uvu. So then you're just going to start at the A's, and you want to see if they can do it 3 times correctly by themselves before you move on to the next syllable. So watch me. A, they. You try that. A, they. A, they. Yay, very good. Do that 2 more times. A, they. A, they. Okay, and then once they've made it past syllable level in the medial position, you provide them with word lists with all the V words that have V in the middle position, like shovel and other words like that, so that they can practice at the word level. Then you move on to sentence level, reading level, conversational level. And if your child is having difficulty producing F or V in the final position of words, then you use your syllable list. Ave, eve, ive, ove, oov. Do the same thing. Watch me. Ave, ave, ave. Now you try it. Abe. Oh, that was your old sound. Let's try it with your new V sound. Make sure your top teeth are touching your bottom lip. Ave. You try it. Ave. Good job. That was really good. And once they have the final V or final F at the syllable level, again, you go from having it in isolation to syllable level. So isolation, syllable level, sentences, reading level, and conversation. I hope you enjoyed this video of how to teach your child how to properly produce the F and the V sounds. If you have any questions, any comments, leave them below. If you want me to go into detail about any other sounds, leave your comments and your questions below. And I hope you enjoyed this video. Like, subscribe, and share this video. Have a good one.